Good morning. My name is John Myers. I'm a third year in San Antonio, and I'll be presenting, as has been said, a final report of a randomized phase 1b trial assessing the sequencing of the E39 and E39 prime cancer vaccines to optimize long-term anti-tumor immunity in folate binding protein expressing breast and ovarian tumors. So these are cancer vaccines for breast and ovarian cancer patients. I have no disclosures. To start with the big picture view, our group is using a vaccine created from tumor tissue taken from general breast and ovarian cancer patients. These tumors are analyzed for certain tumor-associated antigens, which are isolated and packaged into a vaccine. An example of these tumor-associated antigens is HER2, which we are familiar with. In our case, we are looking at a part of the folate binding protein. So the idea is that then these vaccines are given over a series of primary vaccinations and then with boosters to create a tumor-specific immune response, leading to, ideally, tumor regression. These peptide vaccines created from these tumor-associated antigens are antigens that are highly expressed in these malignant cells, and they cause the specific immune response. Peptide vaccines specifically are relatively cheap to manufacture on the large scale and are generally safe. So E39 is our specific peptide we are looking at here. It is analogous to the folate binding protein, which is highly expressed in breast and ovarian cancer. Has been shown to be safe. And our study, the variable in our study was more or less the strength of the E39 protein. You see a representation of a full-strength E39 and the attenuated or weaker version of the E39 prime. Our goal in this study is to evaluate the immune response given by these different strengths of these peptides. We want to avoid the anergy that can occur with repetitive high-dose antigens, such as occurs in allergy shots. And we are trying to stimulate a response similar to like a prophylactic infectious disease inoculation. So we included disease-free breast and ovarian cancer patients. And these patients were randomized to receive either 6 monthly doses of the full-strength E39 peptide, 3 months of the full-strength peptide, followed by 3 months of the attenuated version, and the reverse. At 6 months, we use different measures to evaluate the significant residual immunity, both in vivo and ex vivo, and then the patients were further randomized from there. This is just a depiction of the total numbers in each of the 6 possible primary vaccine series groups paired with the booster. Our total number of patients completing the primary vaccine series was 30, and 28 patients received the booster. And 16 ended up having this quantifiable value of significant residual immunity. There were no differences between the residual immunity groups or between the different booster groups. All related adverse events were either mild or moderate, grade 1 or 2. When we look specifically at the delayed type hypersensitivity between the primary vaccine series combinations, we see a significant increase in the combination of 3 months of the full-strength E39, followed by 3 months of the attenuated version. If we just look at the CD8 positive tumor-specific T cells, we don't see any differences between the primary vaccine regimens. Now, adding the booster group in, if you look at the green and the purple lines there, you see the primary vaccine series of the full-strength peptide followed by the attenuated version. And then after they receive the booster, the green, which is the full-strength booster, demonstrates the significantly increased delayed type hypersensitivity versus the purple actually kind of reverts to the mean when you give the attenuated peptide. And this is suggesting that the booster, if given, would likely be a full-strength peptide. So in the study, we showed that both the full-strength and attenuated E39 peptides are safe and do cause an immune response. As far as the primary vaccine series, the full strength followed by the attenuated version appears to be optimal, and the full strength booster would be ideal as well. And this will form the basis for an upcoming phase 2 trial. Thank you.